My name is Dr. Daniel Garcia. I'm an interventional cardiologist at Garcia Heart and Vascular, and today I'm talking about Heart Month awareness, and I want to discuss specifically the difference between a sudden cardiac death and a heart attack. And I want to start first with a little history. One time I was running at the Memorial Hermann Park, and by the time I just stopped to take a break, I noticed someone was coming through and he started having pressure here, pointing his chest, and he suddenly collapsed. So everybody conglomerated around him to find out what's going on. I saw that, I went to help him, and I found out he had no pulse. So we started chest compressions. We called EMS, the patient was sent to the ER. He was treated over there, and then actually he found out I was a cardiologist. He came to thank me later and became my patient. Long story short, this patient has two things. So first, he had what's called sudden cardiac death, which means that the heart suddenly stopped and there was no pulse, there's no blood circulating in his arteries. And secondly, he had a heart attack, which was the one with the cause that sudden cardiac death. So basically, the difference between those two is that heart attack is like a blow to the heart that can lead to sudden cardiac death, which is basically your heart stopping and then you dying. Of course, this can reverse, as in this case, and what you need to understand is this: both are preventable, therefore you need cardiologists to help you and to address your future risks of having cardiovascular disease. That's why with Garcia Heart and Vascular, we offer you the benefit of preventing and predicting the future with us to get working together and acknowledging your risk factors and your family history.
If you have swelling of your legs, heaviness sensation of your legs, pain, restless legs towards the end of the day, you might be one of the 80% of the adult population in the US who has a condition called venous reflux. I'm Dr. Daniel Garcia, your interventional cardiologist at Garcia Heart and Vascular, and also your vascular specialist. And today I'm going to talk about venous reflux. Nowadays, with the modern lifestyle that we live, we spend most of the time during the day in one position, either standing up or sitting down on a chair and on a computer. That way, the flow around your legs get compromised. That's what generates the venous reflux. The treatment, it's easy, but first we need to have you evaluated by specialists like us here at Garcia Heart and Vascular to identify your problem and target your problem. If you already have symptoms, I strongly recommend, like me who has that problem as well, to start wearing your compression stockings like I do, which will help you to improve the flow in your legs and alleviate your symptoms. For more information about diagnosis, treatment of venous reflux and varicose veins, follow us here at Garcia Heart and Vascular, and we'll help you and make your life better.
As soon as the elevator doors open, you're greeted by the bright and welcoming Garcia Heart and Vascular Clinic. Through clear glass, our friendly team and Dr. Garcia stand ready combining heartfelt care with top expertise. Here, every heartbeat matters. Welcome to a place where excellence in heart health is not just a promise, it's our practice.
So Doc, you're saying that if I go to any other cardiology center, I might just wait months to see a cardiologist and other months to get my test done? Yeah, you find it right, that's correct. Here in Garcia Heart and Vascular, that's the only reason that why patients love us, because we are family and we're together and we're here to help you and we don't take our time. In less than a month, we will see you once you're booked and you will be having your diagnostic testing and your treatment on the way.
Este era un caso que miramos aquí en la oficina hoy, que es muy recurrente con nosotros porque la paciente no ha terminado todo el tratamiento y por eso los síntomas volvieron a recorrer y ahí empezó a sentir nuevamente hinchazo y dolor en las piernas. Esta paciente, como mira aquí, ha hecho tratamiento de la pierna izquierda como a 2 años atrás, pero no ha terminado todo el tratamiento y por eso los síntomas nunca se resolvieron y ahorita estamos tratando las dos piernas y dándole el tratamiento completo para curar ya los síntomas de dolores en las piernas, hinchazo. Por eso aquí recomiendo que una vez que mira al doctor vascular, sabes que tiene doenças varicosas en las piernas y necesita de tratamiento, muy importante que termine todo el tratamiento para las varices de las piernas para que tenga el resultado más efectivo posible y si ya resuelvan ya los síntomas de los dolores, hinchazos y calambres en las piernas que tienes.
Did you know that the biggest cause of death among women is not cancer, but heart disease? And the worst part, many of us ignore the signs. Women and men symptoms can be very different, which can lead us to delay seeking for help. We need to pay attention to the symptoms. Women's heart attack signs: extreme fatigue with no reason, sudden shortness of breath, indigestion or nausea, dizziness or cold sweat. Taking care of your heart is an act of love, and prevention makes all the difference. Adopt a healthier lifestyle, get regular checkups, and pay attention on your body symptoms.
If you have anybody in your family, close relative that has had a heart attack or heart disease, there are 3 things you need to know, and I'll present you right now. I'm Dr. Daniel Garcia, your interventional cardiologist at Garcia Heart and Vascular. So, fact number 1, you or your relative might already have any heart problems and you don't know. The disease, it's ongoing process and takes a little while to build up, so you still start having symptoms or actually develop a real heart attack. 2, you must start doing prevention now. You must start taking care of yourself. You must exercise at least 30 minutes a day. I recommend getting your heart rate above 100 beats a minute at least for 5 minutes during your time you're exercising. That actually helps you to burn some calories and make your heart stronger a bit faster. Third, which is the most important one I want to present to you right now in this case. He's a very young guy. He's only 45 years old. He's got a history of diabetes and was having chest pain for 2 weeks, and he ignored that. He didn't think there was nothing significant to him. End up that he couldn't hold his chest pain anymore, and he showed in the hospital with a heart attack. Unfortunately, it was too late for us to help him because the artery was occluded for such a long time that we cannot actually open the artery, and now he's suffering from a massive heart attack and developed significantly heart failure. If you have varicose veins and are worried about the treatment and concerned about the pain, I'm going to present you 4 factors that are going to actually change your opinion, and the last one is going to blow your mind. I'm Dr. Daniel Garcia. I'm an interventional cardiologist, trilingual doctor who speaks English, Portuguese, and Spanish at Garcia Heart and Vascular. Yes, as you can see in the video, it's done in the office, which is very simple and easy access. Secondly, it's not done in the OR or the hospital as used to be, so it's not very scary. Third, very easily you can see here we apply local anesthesia under the skin. That's the only requirement that's needed. Again, there's no general anesthesia or breathing machine. And lastly, and the most important one, it's very, very, very low, painful, and takes about 20 minutes. You wrap up your leg and you go home same day, and you can go back to work and do whatever you want. So there's no downtime. For more information, follow us here at Garcia Heart and Vascular. We're happy to help you with your vascular health.
Doutor, estaba haciendo ejercicio y me tocó un dolor muy fuerte en la parte izquierda del pecho. ¿Qué hago? Bueno, tiene que hacer tres cosas. La primera, tiene que parar qué está haciendo y mirar qué va a pasar después. Si después de un par de minutos sigues con la misma dolor y no ha quitado esto, tiene que ir a la emergencia. Puede ser que algo más severo esté pasando con tu corazón, como por ejemplo un ataque de corazón. Pero si ha mejorado tu dolor y se siente mejor, si volver a respirar normalmente y la dolor se acalmó, tiene que mirar un cardiólogo. Puede ser que tenha algum problema em teu coração, como uma placa de graxa aí que esteja tapando parcialmente a artéria. E por isso, quando se exercita, a sangue não está passando normalmente. Isso pode também causar-te um ataque do coração no futuro. Por isso te digo, exercício é importante, mas se siente dolor de pecho, isso não é bueno. Tem que chequear-se. Pode ser que esteja passando ou esteja iminente de passar-te um ataque de coração.
Have you heard about Varithena treatment? In this video, we will show you how it works and how it can help you take care of your veins. Here, we identify the area where Varithena will be applied using ultrasound to ensure precision and safety. Now, we introduce the needle to start the application. This is a minimal invasive procedure focused on treating smaller veins reflux issues. We apply Varithena, an alcohol-based foam that fills the vein, effectively closing it. Watch on the monitor as the medication enters and blocks the unwanted flow. The goal is to reduce reflux and improve circulation by eliminating veins that are not functioning properly. Want to learn more? Schedule an evaluation and find out if the Varithena treatment is right for you. Taking care of your vascular health is essential for your well-being.
Is there something that your heart right now is trying to tell you and you're not paying attention? Listen, symptoms like easily getting fatigued, short of breath, or chest pain when you just do mild exertion like walking, going up a flight of stairs could be a sign that your heart's in danger, so pay attention to that. So what would be the next step? Well, the next step, you have the number showing on your screen right now. Give us a call, tell you want to see a cardiologist, we'll check your insurance for you and put in the books for a first appointment within a week. So once I see your cardiologist, what's the next step? The next step, we're gonna order cardiac tests for you. We're gonna do an ultrasound of your heart, an echocardiogram, an electrocardiogram, which is the strips around your chest. We will do the nuclear stress test to see if you have any blocked arteries that might be causing impairment of the flow. And for the last, we offer also the vascular studies here to check the circulation around your body, including your neck and your legs. Doctor, you told me that I need to do all these tests? That's too much, and I have to be driving around the city to get those tests done. Well, you might be wrong again. Here at Garcia Heart and Vascular, we offer all these tests in-house, and I guarantee you that if you book with us today, in less than a month, you have all your tests done and results right here in the palm of your hands, and it's discussed by me with you in our office. Doctor, this sounds to be really good to be true. No, you're wrong again. This is already happening right now, and have people on our Google reviews you can look that they come here and in less than a month we diagnose them with heart disease and they put them on the treatment right away. So in Garcia Heart and Vascular, compared to any other cardiovascular center here in Houston, we don't take our time, we don't sit on your case. We're here to help you, and I guarantee you that in less than a month you're gonna have all the diagnostic testing that you need and you put you in the treatment right away.
So this is Dr. Daniel Garcia, talking from Garcia Heart and Vascular Center, and today we're going to talk about a very interesting case of a middle-aged woman who had a very horrible argument with family members, and suddenly after she started developing chest pressure in the middle of her chest, and she thought she was having a heart attack. Interestingly, when the EMS arrived at her house and did the initial EKG strip, she was having ST elevation suggestive of heart attack. What happened is, after she arrived to the ER, we repeated her EKG, but we didn't confirm that. But still, because she was having chest pain, she has a strong family history of heart disease, we decided her to take to the cath lab to look at the coronary arteries on the heart. Surprisingly, we found no blockages at all, but we found a condition called Takotsubo cardiomyopathy. And what is that? It's mainly when the apex of the heart stops working and forms like a little balloon and gets like hypokinetic, which means it doesn't move like the rest of the heart, it stays still like this. This is caused mainly by a stressful situation, arguments, for example, or like emotional stress events in life that releases a lot of catecholamines in the body, and then it stresses up the heart too much that part of the heart gives up, gets tired, and cannot function. It's a reversible condition, but most importantly, balanced lifestyle, it's important to prevent any type of heart disease, like this one we just explained to you. Come visit us at Garcia Heart and Vascular Center. We can talk more about that and make sure your heart can tolerate any emotion that you can go through. Thank you.
Quiero hablar con ustedes sobre prueba de esfuerzo. Fácil de hacerlo aquí mismo en la oficina. Tarda como 30 minutos, tenemos un acceso por suero e inyectamos la medicina del contraste y ahí podemos mirar cómo está tu corazón. Es importante porque podemos ver si tiene bloqueos grandes suficientes para causar ataque de corazón. Y lo más importante es que eso puede salvar tu vida. Por eso te pregunto, ¿tú tienes cansancio muy rápido, una presión en el pecho, o a veces un cansancio muy importante, que le falta aire, se tiene que caminar un poquito, tiene que hacer ejercicios o cosas en casa, que antigamente podía hacerlo normalmente, pero ahorita se pone más cansado, que no puede tolerar mucho bien, pero puede estar en riesgo de tener ataque de corazón? Por eso convídote aquí a llamar a nosotros en Garcia Heart and Vascular para hablarnos de condición de tu corazón, a ver con la prueba de esfuerzo si hay algo que podemos detectar precocemente un problema cardiovascular que puede sí costar tu vida. Do you think that's worth in waiting months for a test that can save your life? I don't think so, and if you're seeing a doctor who's making you wait for those months, I tell you to stop right now and listen to us. Here at Garcia Heart and Vascular, we are the only cardiology office in the greater city of Houston that can afford to see you, do your test, and discuss all that with you in less than a month, which means that there's no waiting time, there's no jeopardy to your health, there's no danger to your life or to your heart. We do all the cardiac testing here in our office. You don't have to drive around to find a place to go. You don't have to wait long lines. And more importantly, you're going to be dealing with the same staff every time you come here. So won't be no surprises, won't be no more stressful situation, because we care about you. And I challenge you to find any other clinic here in Houston that can do at least half what we offer you. Everything done in the same day, in the same month that we see you. Here, we get you taken care of
right away. That's how we work, and that's why our clinic is so successful in the greater city of Houston. More important to say, we speak not in one but 3 languages. I speak English, I speak Spanish, and I speak Portuguese. Depending on what language you speak, and more important, you're gonna trust us for taking care of your life. Hola amigos, ¿tú sabes la comida que estás comiendo ahora puede ser la principal causa de tus problemas cardiovasculares en el futuro? Sí, yo soy el Dr. Daniel García, cardiólogo aquí en García Heart and Vascular. Yo soy latino como ustedes y a mí me encanta comer la comida latina, pero yo sé que algunas comidas son muy perjudiciales a la salud y a tu corazón. Por eso te digo, si le encanta comer tacos, comidas hechas de harina, gorditas, carnes asadas, frituras, esas cosas, eso sí puede afectar tu corazón y bloquear unas arterias en tu corazón y causarte un ataque de corazón. Si tú no sabes exactamente que estás comiendo es bueno o no para tu corazón, o crees que ya comiste mucho y ahorita tienes chance de tener ataque de corazón, ven a hablar con nosotros hoy. Te garanto que llamándonos aquí a nuestra oficina, nosotros vamos a verte el mismo día o la misma semana y hacer todos los estudios para estar seguro que tu corazón está bien. Y principalmente discutir con usted una dieta saludable y asegurarte que está haciendo la cosa correcta. Un abrazo.
Si tú tienes problemas de corazón, no te preocupes. Muchas veces es un problema que puede ser revertido. O sea, tú puedes cambiar tu vida, hacer un estilo de vida mejor, más saludable, con ejercicio diario de 30 minutos, bajar sal de la dieta, comer menos grasa, comer más vegetales, comer más pollo y pescado que carnes rojas. Eso todo puede cambiar el proceso de dolencias cardiovasculares, principalmente las dolencias causadas por acúmulo de placas de grasa en las arterias de tu corazón. Por eso, si le dieron un diagnóstico de problemas cardíacos, tiene que ver cuál tipo de problemas, porque puede revertirlo simplemente por cambio de estilo de vida. Obviamente, algunos otros están un poco más tardes y no podemos revertirlo, nomás controlar los daños que ha hecho por un ataque fulminante de corazón, por mucho tiempo de presión descontrolada, mucho tiempo con colesterol muy alto. Por eso, lo mejor que puede hacer es mirar a un cardiólogo para ayudar a mantener o mejorar la salud de tu corazón. Un abrazo y te espero aquí en García Heart and Vascular.
If you spend most part of your day on a sitting position, or you spend on a standing position,
you must be aware that the circulation in your legs might be compromised. I'm Dr. Daniel Garcia, your vascular doctor specialist here in Houston at Garcia Heart and Vascular. And I want to make you aware of the circulation problems you might have because of this. The blood flow in your veins starts regurgitation going backwards. That causes to dilate your veins and cause circulation problems. Yeah, you don't know that yet because you're not starting feeling symptoms, or you might already have the symptoms but you haven't noticed. If you feel like your legs are heavier than usual, especially towards the end of the day, at night you have restless legs, you start itching around the lower legs, start itching around your ankles, or you start noticing swelling of your legs more than usual, those are very warning signs that your leg circulation might be compromised already. So what should I do then? Well, first and most important one, you must walk around during your day to allow the blood flow in your legs get to circulate better. Yeah, you gotta help the circulation in your legs. The second and most important one that I recommend, and I'm part of that because I wear my compression stockings, as you can see. Third, you need to see me because we need to run tests, including an ultrasound of your circulation to see if your veins are already compromised. And number 4, if you really have bad circulation in your veins, you might need treatment. Don't worry, we're here to help you, and I promise you that the day you walk in this clinic here, your legs will thank you. Why should you guess if you're gonna have a heart attack or not when you have a technology that can help you with? Here in Garcia Heart and Vascular, we have what's called a stress test. So a stress test is meant to look at your heart circulation with the help of the computer, and we can determine if you have significant blockages that can cause you a heart attack. As you can see in the images here, it's totally painless and it's not scary at all. We provide the most comfort level here while the computer does its job. For more information about stress test, please call us right now and you schedule an appointment today if your insurance allows and get your stress test done in less than a week. This lovely patient came to see me because she was having severe pain upon walking, and then after offering the right diagnosis for her, she was found to have varicose veins. As you can see here, those bulgy veins here wasn't just like ugly looking, they also causing her a lot of symptoms. Then the treatment, which included polylocanol, we inject those veins here and get rid of those. More important was not just getting rid of the veins, but also treating the symptoms. She came to thank me because now she was able to walk without no pain and stand on her feet for hours and hours without any discomfort. The result is right there. Those huge veins are gone. Her leg looks completely different. This is another real case from our Rescue Vein series showing how the right diagnosis and the right technique make all the difference.
Yo soy médico brasileño en los Estados Unidos y además de hablar inglés, hablo español, porque el corazón latino no entiende las fronteras. Yo soy médico brasileño en los Estados Unidos y cuando mis pacientes hispanos entran en la clínica, no los recibo con silencio médico, los recibo con conversa, con calidez y con alma. Yo soy médico brasileño en los Estados Unidos y aunque nací en Brasil, siento que compartimos la misma sangre, la que baila con la música, la que se emociona con la comida, la que abraza antes de hablar. Yo soy médico brasileño en los Estados Unidos y sé que la salud también es pertenecer, sentirse visto, sentirse en casa. Yo soy médico brasileño en los Estados Unidos y aunque mi acento venga de Brasil, mi corazón también late en español. Cuatro cosas que deberías sacar de tu rutina porque envejecen tus vasos y aumentan los riesgos de enfermedad de corazón. Punto 1. Cigarro. No lo consumas, daña el revestimiento interno de las arterias, espesa la sangre, reduce el oxígeno y acelera la formación de placas de grasa. Es uno de los mayores detonantes de infarto, AVC y trombosis. Punto 2. Alcohol. Eleva la presión, altera el ritmo cardíaco, inflama los vasos y facilita arritmias. Con el tiempo puede dilatar el corazón y reducir su fuerza de bombeo. Punto 3. Refresco. La combinación de alto contenido de azúcar, jarabe de maíz y acidez aumenta la inflamación crónica, eleva la insulina y favorece el aumento de peso y la hipertensión. Todo eso daña directamente el sistema cardiovascular. Punto 4. Grasa trans. Aumenta el colesterol malo, reduce el bueno y endurece las arterias. Con el tiempo acelera obstrucciones y eleva el riesgo de problemas cardiovasculares y cardíacos. ¿Quieres cuidar de tu corazón de verdad? Empieza reduciendo estas 4. Sé consistente y mantén tus exámenes al día.
This is Dr. Daniel Garcia here at Garcia Heart and Vascular, and today we're going to do a treatment for the small sac in the vein. This is a lovely patient and she's been having a lot of leg pain, especially at night, a lot of edema on her legs, itching. So she was smart enough to hear us on Instagram and came here for a checkup. And then the first thing we did for her was the ultrasound, that indeed confirmed that she had venous insufficiency on both her legs. After she tried compression stockings for 3 months, she still had the symptoms. So then we offered her what's called endovenous treatment. We're going to go inside the vein to inject the medication. This medication is made of a glue, medically approved, to close off the vein. You probably don't know this, but back in the days, this treatment started with a surgery. So you have to take it to the hospital, do a general anesthesia, cut open the leg, and strip off the vein. These days, with needles, with this small catheter here, we are able to inject the glue inside of your vein and block off the vein. It's the same principle as if you have just removed surgically your vein. About this, because it's totally painless compared to the open surgery, you don't have to go to the hospital. As you can see, I'm here in my office doing this procedure right now. And more importantly, the recovery is immediate. You're gonna go walking home the same way you came in, and the amount of pain you're gonna have post-procedure is close to zero. The only pain you're gonna feel is the needle insertion through the skin to penetrate, to inject the medication. We also provide local anesthesia to numb it up the area that you're gonna get the needle and catheter through your skin. So if you want more information, if you're worried about your veins and this innovative treatment for your veins, follow us here at Garcia Heart and Vascular and come get your veins checked up today. I wait you for here.
¿Sabía que las varices tienen 5 etapas? Que la mayoría de las personas solo es la cuenta cuando ya están en la tercera. En este episodio de Rescue Vein Series te voy a mostrar cada una. Todo empieza con los vasitos, esas venitas finas, azuladas o rojidas en la piel. Casi que no duelen, pero son la primera señal de que algo no va bien con la circulación. Luego, las varices se agrandan, se dilatan y se vuelven tortuosas. Puedes sentirlas abajo de la piel y es común notar cansancio, pesadez o dolor en las piernas. Muchos piensan que es solo algo estético, no lo es. Cuando la sangre empieza a acumularse, aparece la hinchazón, sobre todo en los tobillos. Suele presentarse al final del día o tras pasar mucho tiempo de pie. Es el cuerpo avisando que la circulación está sobrecargada. Con el tiempo, la piel cambia, puede oscurecerse, endurecerse o incluso descamarse. Ese color marrón es una señal de alerta y requiere atención médica inmediata. La fase más grave es cuando aparecen heridas que no cicatrizan fácilmente. Las úlceras venosas son dolorosas y muestran que el problema llegó a su límite. No espere llegar a este punto. Cuanto antes hagas el diagnóstico, mejor será el resultado. Comparte este video con alguno que piensa que los vasitos son solo estética. Podría ser el aviso que evite un dolor futuro.